Hello, this is Dr. Michael Rothman. And in this video, I want to talk to you about the use of medical marijuana, specifically if you have multiple sclerosis. I've taken care of quite a few patients over the past few years with multiple sclerosis. And in addition to some of the other metabolic interventions that I've used, I've put them through the New Jersey Medical Marijuana Program. And it's indicated for multiple sclerosis, the use of cannabis, to help nausea, vomiting, muscle spasticity, weight loss, anxiety, sleep. All of these symptoms are associated with multiple sclerosis. And by using medical marijuana or medical cannabis, whatever term you prefer to use, you can use one substance, one drug, instead of several other drugs. And so it helps so many different things at the same time. And the thing about the medical marijuana is it has extraordinarily low side effects. In fact, the biggest side effect of marijuana is that it causes euphoria, meaning it makes you feel good. So that's not such a terrible side effect. Now, some people have problems with the psychotropic effects of medical marijuana. But if you do get this through the program and go to a dispensary, you can get different strains of marijuana that have different effects. And if you use the high CBD strain, CBD stands for cannabidiol, it has zero psychotropic effects, but it has very positive effects on all the symptoms that I just mentioned. But the use of marijuana for multiple sclerosis goes way above and beyond just treating symptoms. And this is the really exciting part of this, is that there's lots of research showing that cannabis, that medical marijuana can actually help your disease. In other words, it can actually protect your nerve cells from damage. In fact, the United States government has a patent on CBD as a neuroprotective agent. So the CBDs, the cannabidiol, can actually protect your nerve cells from damage. They can actually also protect the oligodendrocytes. These are the cells that make the myelin sheath. And as you know, if you have multiple sclerosis, I'm sure you're aware of this, it is the destruction of the myelin sheath that leads to the symptoms and the disability of multiple sclerosis. So if you can protect these cells, you can actually limit the damage. So I've had patients that I've been treating for just the past few years because this is a relatively new program, but I've had patients that have been using marijuana on their own for decades that have these diseases like multiple sclerosis, and they're doing fantastic and probably a lot better because of these neuroprotective effects. So if you do have multiple sclerosis, I would urge you to contact my office. There's so many things that we can do to help this terrible disease above and beyond just the typical pharmaceutical interventions. And also diet plays an important role, and metabolic balance plays an important role, hormonal balance. And then you want to minimize the use of drugs that are toxic. And so by using medical marijuana, you can really reduce those toxicities and also the other benefits, the neuroprotective benefits that I just mentioned. So I hope this video is helpful for you, and I hope you have a great day.